All right, I'm here in Des Moines, Iowa, and check out where we're at. This Capitol building is super unique, and I think it's super neat. You're not here for that, though. You're here to learn how Medicare works in Iowa. Now, Des Moines, Iowa is the insurance capital of the U.S. A lot of insurance things happening here. We all have our feelings about insurance, and again, hopefully you understand on this channel, we give you opportunities to know when it makes sense. We will also tell you when it doesn't make sense, and Medicare is the national health care and insurance for seniors. So it's a very important part of the channel, very important part of the US, and yeah, I'll leave it at that. Let's start on the Medicare supplement plan side of things here in Iowa. Now, cost is always a big deal of supplement plans. Nationally, if somebody were looking to go on a supplement plan G as a 65-year-old, the average is $150 per month. Here in Iowa, it's $125 per month. Nationally, if you're looking to get a plan N, the average is $120 per month. Here in Iowa, it is $95 per month. So you are considerably lower than the national average. On top of that, you also have a lot of opportunities for discounts here. So I'll talk about three of them. The first is going to be a household discount, and there are a few versions of household discounts, but to keep it simple, imagine that me and my spouse are both on a supplement plan with the same insurance company. There are insurance companies that will say, hey, since you're both with us, we'll give you a discount for that. There's a discount called a wearable discount, where if you're willing to wear something like a smartwatch, a Fitbit, an iWatch, maybe a Garmin, and then you can sync that with the insurance company, there are companies that will say, hey, now that we know that you're exercising and you're active, we'll give you a discount for that. And then finally, the last discount to talk about here is called an annual discount. If you're willing to pay your premiums all up front for the entire year rather than month to month, there are insurance companies that will give you a discount for that. So on top of this, there are some companies that will let you stack those on top of each other. So your rates are already considerably lower than the national average. You throw in these discounts and it gets absurdly low here in Iowa from a supplement plan perspective. Very, very low rates. And this is again why I'm always harping on use an agent who is licensed and familiar with your area so that they can find a supplement plan that fits in your budget. They can put you with a company that's reputable and that has consistent rate increases, and they can find you these additional discounts. Because again, if you're going straight to the insurance company and asking them about supplement plans, I can promise you they aren't going to say, hey, our competitor over here offers better rates or more discounts than we do. You should go talk to them. That just doesn't happen. It never costs you anything to use an agent. I'm not even saying you need to use us. Use our competitors. Just use an agent who can help you find these plans. If you do want our help, we're happy to do it. Plans here in Iowa are attained age plans. What that means is that they're based on the age that you have attained. There are three ways that supplement plans can kind of be written. The first is attained age that we'll talk about here. The next is issue age, and then community rated. Now, attained age plans start the lowest, community rated starts the highest, and issue age is kind of in the middle. All of these plans will have annual increases based on rising healthcare costs, inflation, and how that specific insurance company that you pick is performing. So all three of those have rate increases. The difference with attained age plans is you could see 2 rate increases in a given year because they will give you a little bit of a bump when you've attained a new age on your birthday. We sarcastically refer to this as a happy birthday increase. When you're 65 years old and on one of the supplement plans, when you have a birthday and turn 66, you've attained a new age and you get a little bit of a bump. So 2 potential increases with an attained age plan. Iowa doesn't have any special rules when it comes to guaranteed issue or switching from one supplement plan to another. So if you did want to switch from a supplement plan, let's say I'm on a plan G and my insurance company's rates are increasing faster than I would like. If I wanted to switch to a different insurance company, I would have to go through medical underwriting. That would mean I would have to answer medical questions. If my health is good, shouldn't have any problems. If my health is poor, then I could be charged higher than normal rates or even denied on that switch. Similar concept here. If I was on a plan G and maybe that was too much coverage for me and I wanted to switch down to a plan N, even though I'm switching down in coverage, I would still have to go through medical underwriting. Insurance companies could deny me or charge higher rates if my health is poor. So medical underwriting is a big topic that we'll talk about in the Advantage plan section as well. And this is just moving from supplement plan to supplement plan. Again, in the Advantage section, I'll talk about moving from Advantage plan to supplement plan. Nationally, the supplement plan penetration rate, so the number of people who are picking a supplement plan as opposed to an Advantage plan, is 21%. Here in Iowa, it's 43.4%, very high, one of the higher penetration rates for supplement plans in the country, again, because you have really low rates here, which is fantastic for people looking for supplement plans. This isn't me saying you should or shouldn't get a supplement plan. Those are just the numbers that we see here in Iowa of the number of people who are picking it. The last part of the supplement plan conversation before we move to Advantage would be talking about those who are pre-65 and qualifying for Medicare. You can qualify for Medicare before 65 if you've been disabled for 24 consecutive months, if you've been diagnosed with end-stage renal disease or ESRD, or you've been diagnosed with ALS or Lou Gehrig's disease. If any of those apply, you can get Medicare. Now, in most states, you don't have a lot of options from a supplement plan perspective. Some states you have 0 options. Some states you only have like 1 letter, and they can also be extremely high, like 5 to 10 times more than what somebody who is just 65 would be paying. Unfortunately, Iowa, you're not a great state for those who are qualifying for Medicare before 65 who want a supplement plan. You really just have Plan A, and you're looking at around $500+ per month, so considerably more than somebody who is 65 would pay for the same plan. The kind of silver lining here is that when you do reach 65, you do have a new window where you can pick up a supplement plan, any of the letters, and you would be paying the same amount that any other 65-year-old would be paying. It's just pre-65. There's not a lot of protections here for those who are qualifying for Medicare that way. Now let's move over to the Advantage plan side of the conversation. So from an Advantage perspective, a big number that we look at is the maximum out of pocket. Nationally, the average is $5,000. So once you reach this maximum out of pocket, the insurance company will take care of 100% of the rest of the costs. Here in Iowa, the average is $4,000. Now these are averages, so you will find plans that are higher and plans that are lower, but that is the average here. Quite a bit lower than the national average, which is a good thing. As is the case with Advantage plans nationally, the more rural you are, the fewer choices that you have to pick from. As you get into larger cities, you'll have more of a choice and a selection of Advantage plans because insurance companies will be in larger metropolitan areas that have more hospital systems and hospital networks that they can work with. So just keep that in mind. Iowa, you do have some pretty rural areas here, so your Advantage plan selection might not be the same as if you're going into one of the bigger cities of Iowa. The Advantage plan penetration rate nationally is 50%. Here in Iowa, it's 35.5%, so quite a bit lower than the national averages. Again, I think part of that is the rural nature of this. I think part of it is the lower cost of supplement plans. So again, this isn't me saying you should or shouldn't, just understand that those are the numbers here, and it will be influenced based on where you live. Now, we talked about switching from a supplement plan to a supplement plan, but now let's talk about switching from an Advantage plan to a supplement plan because you are following the same national rules here. 4 things to cover. 2 of them are trial rights. Trial rights refer to your ability to try an Advantage plan and then switch back to original Medicare and a supplement plan. So the first trial right is when you go on Medicare at your 65th birthday. It has to be at your 65th birthday, not after 65th birthday, and you choose an Advantage plan. If that is the case, you have a 12-month window where you can try that plan. If you don't like it, you can switch back to original Medicare with no medical underwriting and pick up a supplement plan with no medical underwriting. Great option there. The second trial right is if you go on Medicare, and this is not around your 65th birthday at any age. So if you go on at 70 years old and you pick a supplement plan first, then in the future, if you'd like to try an Advantage plan, you could switch off of your supplement plan onto an Advantage plan, and then you have a 12-month window where you could try that Advantage plan and switch back to original Medicare and a supplement plan with no medical underwriting. The third way to switch from Advantage to supplement plan would be if you qualify for a special election period. Now, there are several of these, but the one that I'll talk about here is if you're moving outside of your Advantage plan's coverage area. So let's say that I'm here in Des Moines and I move to where my Advantage plan doesn't cover it because Advantage plans are zip code specific, then I would have an option to move back to original Medicare and a supplement plan with no medical underwriting. There are other special election periods. That's one of them. If you want to look into more of those, just reach out and we can go through different special election periods. So all 3 of those are without medical underwriting. It's easy. You're not going to get denied. You're not going to be charged more by moving back. The 4th one is you could go through medical underwriting. So you're just deciding to switch. You don't have a special election period. You aren't in your trial rights and you just want to go from Advantage to supplement plan. You would need to answer medical questions. And then again, based on your health, if your health is good, you'll be approved. If your health is not good, you could be charged higher for your supplement plan than normal, or you could be denied completely. So those are kind of the 4 ways to do it. When you're making these changes, there are important periods of the year where you would want to do this because when you're on an Advantage plan, Advantage plans typically come with drug coverage or Part D coverage, and you can only get drug coverage during certain times of the year. So as an example, the annual enrollment period from October to December is a time where you could pick up a Part D drug plan. And so if you are wanting to make that switch from Advantage to supplement, do it there in that annual enrollment period. And then that goes into effect on January 1st of the following year. So just timing is important here. Make sure you're working with an agent, again, to find whether that's a supplement plan or even the Advantage plans. Will run through and look at your providers, make sure they're in network on the plans that you're looking at. Again, even if you don't use us, use somebody that would be able to look through all of this. I do have partners who are licensed and familiar with the plans here in Iowa. If you do want our help, my email is in the description, or you can reach out at theretirementnerds.com. Now on our drive here, we saw a lot of cornfields. We have the Field of Dreams that was recorded in part of Iowa. So I like to leave keywords at the end of my videos. And then if you leave these keywords in the comments, then you and I can both know that you've made it this far. I can take those comments a little bit more seriously. So the secret code word for this video is anything related to corn. If you mention corn, or even if you want to mention Field of Dreams and baseball, Kevin Costner, whatever floats your boat there, so any of those two, then yeah, I can take those comments a little bit more seriously, and you've proven that you've made it this far. We're gonna go explore a little bit more. I think you saw my kids just run by there a little bit. Iowa has been great. It's getting a little windy, but so far so good. Thank you for making it this far. If you haven't subscribed already, please do so. It helps more than you know. I will see you in the next video.